Welcome to the Africa Public Health Podcast from Africa CDC, your go-to source for information on key continental health security issues. I am your host, Andisiwe Michelle May. In this series, you will get valuable insights from African scientists and researchers as we unpack important public health topics that impact the continent and the latest developments in public health research. In this episode, we explore the vital integration of non-communicable diseases into primary and secondary healthcare systems in Africa, with insights from a distinguished public health specialist renowned for his pioneering work in advancing healthcare on the continent.
My name is Adelard Kakunze. I'm a medical doctor by training. I've been working with Africa CDC for the last 6 years. I joined at the inception in 2018, where I was supporting the office of the inaugural director as a public health technical officer. I joined the Division of Disease Control and Prevention when it was established in September 2020 to lead effort to establish Non-Communicable Disease, Injuries and Mental Health program. At that time, I was in charge of leading the development of the Africa CDC strategy to address those conditions. After the launch of that strategy, I'm now in charge of leading the implementation. So now the unit lead for non-communicable disease, injuries, and mental health under the Disease Control and Prevention Division at Africa CDC.
Can you tell us where you were based before you joined Africa CDC headquarters in Addis Ababa?
I was based in Burundi, my home country, where I was leading a private clinic focusing on diabetes, particularly type 1 diabetes. I was also a social entrepreneur working on innovative solution to address non-communicable diseases. I was implementing a project to use mobile health technology to be able to conduct population-based screening for risk factors and provide tailored education to those in need. And that project has received some regional and global recognition. I was one of the Mandela Washington Fellows, program initiated by former President of the United States, Barack Obama. I was also among the first cohorts of the Tony Elumelu entrepreneurship program and other program at the regional and global level.
Was there ever a moment, incident, or an accomplishment that had a great impact on you and your career that you treasure, or one that motivates you in the work that you do now and hope to achieve in future?
I worked a lot on type 1 diabetes. It's commonly known as the diabetes for children, because it affects mainly children or younger people. Looking at the toll on individual, the families was really heartbreaking. So it was one of those moments that I decided really to focus on these areas. I remember vividly when 16 years old girls were admitted to the clinic where I was working, and she was really lost. Because for almost 2 years, she had been facing challenges. The family accused her of being pregnant, or at another time being possessed by spirits. Well, she was having a disease they could not understand. You see, a child who is craving, who is eating a lot, but in the meantime losing weight. A child who is always be thirsty. A child who will have all the symptoms for pregnancy, but find out that is not pregnancy. So the family were also confused. And it was after all the struggle that they decided to bring to the clinic. And we just did simple tests looking at blood sugar, and it came out that she has a type 1 diabetes, which is not common, but which affecting a significant portion of our young people now with changes in nutrition and behavior. And for me, it was sort of a wake-up call that we need to focus on those diseases. Because I still remember what the young girl told me when we gave her the diagnosis. She said, I wish I had HIV. Because even now, how am I going to get treatment? That I'm rejected by the family, I'm alone. How am I going to have money to buy insulin, which is still out of reach for many people in on the continent? And that was where I say we need to do something. Being part of the International Diabetes Federation network, we were able to work with the Ministry of Health to ensure that Burundi is among the country supported by program that was giving insulin for free and providing trainings for those young people. It's still one of the things that really motivate me to do more in this area. Was when it comes to non-communicable diseases, there's still a lot of challenges due to the neglect that policymaker governments are not paying the right attention.
That's a very powerful story, and I think it's a good opportunity for us to segue into the foundation of this discussion. What are non-communicable diseases?
As the name, it's a group of diseases that cannot be passed from one person to another. They are also known as chronic diseases, but the difference with other chronic diseases, they are a result of genetic, metabolic, environmental, and behavioral factors. They are not resulting from an infection. For example, HIV is a chronic disease. The person can have it for quite some times. It can be passed to another person. So it's a communicable, it's an infectious disease. Cardiovascular disease, let me give an example. Hypertension can be a result of genetic or metabolic or behavior factors. It cannot be passed to another person. We have 5 majors. We have what we call cardiovascular diseases, commonly known stroke, hypertension, coronary diseases. That's one group that's really having a high burden in terms of morbidity and mortality. We have the chronic respiratory diseases with the common known asthma. I already mentioned diabetes. We have type 1 affecting mainly children and young adults. We have type 2 diabetes, which is more prevalent, affecting adults mainly from 35 years old and above. We have also gestational diabetes affecting pregnant women. Another big group is cancer. We find cancer that are a result of an infection. For example, a liver cancer that can result from hepatitis B or C infection, or a cervical cancer, which can be a result of an infection by a human papilloma virus. But the difference here is the cancer cannot be transmitted from one person to another. Hepatitis, you can transmit from one person to another, but when it's evolved into a cancer, it cannot be transmitted. That's the difference. And for cancer, the most prevalent in Africa for male are prostate cancer and lung cancer. Colorectal cancer are also predominant. For females, it's breast cancer and cervical cancer. On those four now conditions, we have add another one, which is the mental health condition. Mental health now is recognized as the major non-communicable diseases with common conditions such as depression, anxiety. So those form the five major conditions, non-communicable diseases, and they are linked to five major risk factors. I talked about the factor, the genetic, what we call non-modifiable factors. But there is also modifiable factors, which are behavioral factors such as tobacco, alcohol consumption, unhealthy diets, excessive consumption of oily or fatty food. It can be physical inactivity. So those are modifiable factors. And this is we will see when we talk about the strategy to control. If you focus on those and we educate our population, we can drastically reduce the occurrence for people to develop non-communicable diseases. But there are also some other factors such as obesity, which is a metabolic factors, higher blood pressure. So those are also factors that we can also work on, so we can modify. There are also environmental factors such as air pollution, which contribute a lot when it comes to lung cancer, chronic respiratory diseases. In general, we consider that socioeconomic factors such as poverty, lack of education account a lot in the occurrence of having non-communicable disease, because people, disadvantaged people, poor people, uneducated people are more exposed to those harmful products. They are most likely not going to have access to preventive and curative services, hence increase the risk of developing non-communicable diseases.
How do non-communicable diseases pose a significant challenge to healthcare systems on the continent?
Now, the non-communicable disease is called NCD, abbreviation of that. NCD now represents the leading cause of death worldwide, killing around 41 million each year. This is 71% of all deaths globally. So when it comes to Africa, it becomes more challenging because we are experiencing what we call a double burden. So on one hand, the epidemiological trend for communicable diseases, it's decreasing. The trend for NCD now is rising rapidly. And the projection that is that the non-communicable disease will exceed communicable, maternal, perinatal, and nutritional diseases combined as the most common cause of death by 2030. So it's a problem globally. We've managed to improve life expectancy. People are living longer. We've managed to control communicable diseases. The double burden now is putting our health system, which are not well equipped and are still battling with communicable diseases. For example, the rate for endemic diseases that are here and we're still battling with, such as HIV, TB, malaria, are still high. And we are also seeing more and more emerging and re-emerging infectious diseases. Today we are talking about Mpox, the monkeypox. Recently we were battling COVID-19 and Ebola, which is still, in some part of the continent. So with all those challenges, now you add those non-communicable diseases, you see it's putting our health system really a lot of pressure. And the NCD will also bring other challenges. When someone is diagnosed with non-communicable diseases, as I mentioned, it's a chronic disease. It's a condition that the person will have for the rest of their life. And it putting the individual families into poverty, because they will not only pay for the treatment, but they will have to adjust the diet. It's affecting productive people, may lose the job. It's really bringing, NCD are bringing a lot of challenges in Africa.
You've spoken about challenges that healthcare systems on the continent face. Could you elaborate on some of the main barriers that countries are facing with integrating NCD management, specifically into primary and secondary healthcare?
Good question. So when we say health system, we need to understand the workforce, the service delivery, the lab, all the function. So the challenges or barrier that we are having is that our health system are not equipped to deal with non-communicable diseases. I gave you an example of that young girl. They have to transfer her to the capital in the tertiary hospital for her to be properly diagnosed. That is a symptom of how our health system are not well equipped for non-communicable diseases. So we don't have the skilled workforce to deal with these diverse conditions. I'm not talking about those others who are not known, like hemoglobinopathy, sickle cell, digestive. I'm not talking about cancer. Those commonly known hypertension, diabetes. We don't have skilled workforce to be able to deal with it. Second, we don't have the right infrastructure. Even if we have the skilled personnel to confirm, we need to have lab system. We need to have equipment. Even if you diagnose, you need to treat. You see, it's a whole combination. So when we say health system, we need to look at those key areas to really be able to holistically manage patients or someone with non-communicable disease. We are very far from them. You mentioned something very important about integration, and that's a key word or magic word that everybody have been talking about. But we have challenges. When you talk about integration, we need to know how our health program are being designed in Africa. I thought it was in Africa, but recently I had the opportunity to visit China, and I've seen how the health programming is quite vertical. You could see a TB lab assigned, HIV lab assigned, malaria lab assigned, but they can afford it. We cannot afford it in Africa. So when you talk about integration, we need to know where is the funding coming from. So where the Global Fund is funding HIV, TB, malaria, they are funding services, they are decentralizing services only for those three conditions. And this is where the problem starts. And when we're talking about integration, we need to understand how can we do it, because it's not everything that you can integrate. The prevention and control strategy for HIV we can learn from it, but are different from what we will use for non-communicable diseases. Same for malaria, same for TB. So we need to understand how to integrate. But more importantly, we need to ensure that we have the funding to do that. Because as far as I know, Global Fund only is focusing on those three diseases, although now they are starting, to encourage country to include NCD and mental health. We at Africa CDC, we are promoting some strategies and intervention that will ensure that we are able really to integrate, starting at the community level.
You touched on something very important, which is health financing, and briefly alluded to some of the strategies and interventions that Africa CDC is implementing. How can these barriers be addressed effectively from both a policy and a practical standpoint?
For example, when it comes to funding, we know it's linked to lack of political commitment. How can we ensure that we are increasing the political commitment, that's funding for NCD? Because we need to really look back and learn how HIV have been able to really mobilize the required resources and take the same approach. And this require really bringing this advocacy at the highest level. And that's what Africa CDC is doing. So we've been having, after a decade, extraordinary summits on HIV, TB, malaria. And now what we are working on is to ensure that non-communicable diseases, maternal health is also included in the agenda so that it get the required attention. Working with the African Union Commission to ensure that we have a champion, a head of state champion for non-communicable disease, injuries, and mental health. A head of state that can talk among the peers and convince them to increase the allocation that they are giving to non-communicable diseases. I'm taking time to talk about financing because this is where the problem really hang. Because we know the strategies. We know, I mentioned the prevention strategies to address the risk factors, but we lack funding to really be able to integrate this at all levels and all sectors. The other thing is to really promote innovative financing. At Africa CDC, we've been able to promote the multi-sectoral coordination. Looking at, for example, the Agenda 2063, their flagship program, one is to increase the intra-African trade with now the Continental Free Trade Area that have been established. We know that this will have an impact on the health of our population because those products we're talking about, salt, oil, to some extent tobacco, will be able to move, from one region to another, one country to another. How can we work now with the Continental Free Trade Area to mitigate that, to ensure that the taxes that result from this, trade can also support public health intervention. And with this now financing, we can now be able to integrate non-communicable disease prevention and control strategy at all levels, all level of the health system and all sectors. Because if we want to succeed, we will need to address, for example, issue around education. We need to work with the Ministry of Education to ensure that all our girls are vaccinated against HPV. We work with Ministry of Transport to put in place measures to reduce road traffic injuries, which is also one challenges we have when it comes to non-communicable disease and increasing rapidly. We have to work with the ministry in charge of urban planning to ensure that we have cities that are not polluted, cities that are friendly for people who want to do physical activity. The other areas where Africa CDC is working is, of course, workforce development, building on existing program. For example, what we are doing is to embed NCD and mental health into the field epidemiology training program.
Can you please expand on what the Feed Epidemiology Training Program is?
The Feed Epidemiology Training Program has been there for almost now 40 years. It's one of the programs that have helped the continent to be able to deal with those outbreaks, starting with the Ebola outbreak that hit the continent hardly in 2014. I'd like to give also some example. Even if you look when we established Africa CDC, you look at the percentage of graduate from the field epidemiology training program that joined to now operationalize this continental body that is now responding effectively and supporting the continent to respond to outbreak. You will see a huge percentage. So building on those strong program are very important, really, to be able to now have epidemiologists that will go and work with national public health institutes, Ministry of Health, to improve on surveillance of and non-communicable disease and mental health, to improve on development of prevention and control strategy, and of course support in ensuring that they are developing guidance to educate the general population. So we have started with mental health and very soon with non-communicable disease, ensuring that we are embedding those conditions in this very powerful training program. I can talk also about the flagship priority for Africa CDC, which is ensuring that we have health products that the continent needs. We've learned a very hard lesson with COVID. That's why when we started, it was more focused on vaccine. But now we are working with our colleague from the partnership at health product manufacturing, food procurement, to ensure that we have the medicine technology diagnostics that we need. We need to ensure that we have quality assured drugs, affordable drugs that are produced on the continent.
Earlier, we spoke about your journey as an entrepreneur and you touched on telemedicine. What do you think is the role for technology and innovation in enhancing the integration of NCDs into healthcare systems?
That's a good question, and the question that is always there. Now it's more on what is the role of AI in fighting this condition. But the question is, are we ready? We are seeing prototype, pilot projects, well taught, but not in Africa, outside, and come and say, okay, please, you need to adopt. And how can we ensure that it's also nurture the entrepreneurship ecosystem? The whole ecosystem is another thing. Let's start from the users. Let's promote them. Let's empower them so that they are able to, to bring in those technologies in the work they are doing. Because they will be the one to know where it fits well. And after that, we then look at the challenges in terms of infrastructure, electricity, internet connectivity, etc. Giving you a simple example, oncologists working in a rural area in Rwanda, if we had the opportunity to be trained on those new technologies of screening, improving screening, how we can do a remote, diagnosis, will be better place to know how to integrate this rather than waiting for a miracle solution coming from outside, where it somehow help but will not really take into account the whole ecosystem.
Do you have any other examples you can share with us of other emerging tools that aren't necessarily high tech that are being implemented at community levels?
The other one is the mobile technology. This is an area that's really have caught my attention since you called that I was working on a project on assessing risk factors among general population and provide tailored education. And that was before WhatsApp. That was before all the those major messaging platform. I think mobile health technology it's a powerful tool that can really improve on the health of our population. We have a young population that is using those gadgets a lot, and we now seeing a increase in, for example, mental health challenges, which is on the other hand, associated with the use of social media, because now we are having cyberbullying, all sort of issues. So using those platforms now and partnering with those big company, big names, Facebook, WhatsApp, to see how to develop tailored solution, for example, to address youth mental health in Africa can go a long way. Sharing information, equipping community health workers to, be able to transmit, data. It's common, but we need to do more to ensure that we have the whole system that is digitalized. It can really help a lot. Non-communicable diseases are with us. I know if you ask anybody, we have personal stories, either in a family, friends, or colleague. So it's affecting all of us. So we need to prioritize it. We need to ensure that we are really giving it the right attention. We know strategies for prevention and control that can work, but we need really to amplify. When you look at the projection, it's really looking bad. And doing so, we'll be protecting not the generation. The generation we might be late, but the generation to come. And that will require for us to understand that I need to do something. I need to, start healthy diets. I will drop, let's say, sugar and start teaching my children that avoiding sugar is good. I will start educating family members that eating green is good and start buying fruits. I will start, doing exercise. It's everybody has something to do in this regard. But again, we also need population-based, intervention to also do that. And this is where organizations such as Africa CDC, WHO, and others are there really to promote and support countries to adopt that.
Thank you to Dr. Adelard Kakunze for joining us on this episode. Whether you're an expert in the field of public health or simply interested in learning more, the Africa Public Health Podcast is here to serve as a reliable resource for you. Please get in touch at africacdc.org. Until next time, I'm Andisiwe Michelle May. This is a Volume Podcasts production.